And I will welcome you all into this space. As I mentioned, this is the last of 8 cohort coaching sessions that we have today with Jamie Seller from RI International. We are talking today about law enforcement coordination in relation to mobile crisis outreach teams. So welcome, everybody settle in. I will start with our quick disclaimer that this training is offered through the CARE TA Center and funded by the California Department of Healthcare Services, administered by CARS. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the California Department of Healthcare Services, although we are thankful for their support. The CARE TA Center provides a comprehensive array of technical assistance and training to California's Mental Health Service Act funded stakeholders and partners. Together, we strategically plan, effectively implement, and continually evaluate and improve on the behavioral health coordination and crisis response work you all are doing in the community. We are made up of a group of partners and team members. And so this includes CARS, RI International, NAMI in California, C4 Innovations, Impact Justice, and Stanford Sierra Youth and Families. We offer an array of services and technical assistance that is available as well on our website. Those include needs assessment listening sessions. We have an annual conference on May 25th. We have training and technical assistance, a resource library, newsletter, social media, and a 5 Things Needs to Know digest along with cafecitos. As I mentioned, this is session 8. Today's topic is law enforcement coordination as it relates to our mobile crisis outreach teams. Jamie Seller, who has been with us graciously and with his wisdom and knowledge and experience that we extremely appreciate in the field and at the CARE TA Center. So Jamie, thank you so much for being here.
Well, it's good to be here, and I'm really excited that so many people have been here for all 8. I know how difficult that is. It's been tough for me to actually be here for all 8. And I didn't have an option of canceling 5 minutes before or just not logging in. So I do appreciate that you guys are coming through. We're kind of ending these sessions here after today. So I kind of want to get through the presentation fairly quickly and just make sure that we have enough time for any Q&A since this is our last meeting together. The screen that's up right now is the introduction. For those of you who've been here a lot, you've heard me do this. My name is Jamie Seller. I'm a licensed professional counselor based out of Arizona. Work for RI International as the Chief Strategy Officer, which is a beautiful title. It means I do consulting, business development, and oversee our training programs, both nationally and internationally. Probably been in 20 states in the last 3 years and probably 2 times that as far as counties, supporting them in crisis system development. And my history has predominantly been working within crisis systems. I was fortunate enough to be one of the writers for SAMHSA's national guidelines that came out in 2020. And really where I probably put in the most work is going to be facility-based services as well as the mobile crisis outreach team components for that. So today, really what we're going to lean into a little bit is SAMHSA guidelines again. That should be the model that we're all kind of thinking a little bit about moving toward. And what we're going to do is we're going to talk a little bit about what SAMHSA says about the integration of law enforcement mobile crisis services. It is fairly well defined. We're going to review actual data from Maricopa County regarding integration. And the reason I lean on Maricopa County, and it's in Arizona, is because it probably is the more, I'm going to say mature. I'm not going to say best. It might be. But it definitely is a very mature crisis system that really pushes a lot of folks toward the crisis system, call center, mobile teams, and facility-based services. So when we talk about mobile teams and integration with law enforcement, I'm going to say I work across the country. I don't know another community that has as many people being seen by civilian mobile teams as Maricopa County. But even so, there's going to be integration between law enforcement teams and civilian mobile teams. So I think it's a good model to go ahead and think about, or at least start seeing what the data is. And a place has kind of had some trial and errors and some evolution. And while we may not be perfect where we are now, I think we're kind of ahead of the curve. We're going to identify why collaboration between law enforcement mobile is important. And you guys all know that. I don't need to spend a ton of time on that. And then really what we're going to do is we're going to talk about some tips on working with law enforcement, because we've got 2 very definitive and distinct different cultures that we need to kind of lean into. And usually I'm going to think maybe on all 7, my final tips were usually on 1 slide. This one I've actually got 2. I've got a lot of narrative in the tips. because I have learned a lot while I was running mobile teams here in Maricopa County. 24 teams, 4.5 million people, and quite frankly, I think your relationship with law enforcement is going to be very dependent on whether you're successful or not. So let's go ahead and move it forward. So we're going to talk a little bit about how SAMHSA views law enforcement. A couple things are going to jump out at you if you read the SAMHSA national guidelines. One is they use the term police 58 times. They also use law enforcement 102 times. Remember, the SAMHSA guidelines is about 80, 84 pages if you start looking at bibliography. So they're averaging law enforcement or police probably 1.5 times per page that they've got down there currently, maybe as much as 2. So what we do understand is that it absolutely is important that there is an intersection between law enforcement and mobile crisis services. SAMHSA guidelines will say that law enforcement crisis response are an essential partnership. But once again, we may differ from what communities typically are doing or thinking about in terms of how that relationship should look. SAMHSA is going to be very clear on mobile crisis teams should be the default and the primary street level response to people that are in a behavioral health or substance use disorder crisis. Law enforcement should intercede when there is an issue of public peril or public safety for which they are uniquely qualified to work with. Now, if we do take a look at the majority of behavioral health and substance use disorder crisis in a county, overwhelmingly, we can discuss numbers, but overwhelmingly, there is not a situation that involves true public peril or true public safety. Now, what I am going to say is you're starting to think a little bit about that intersection point. I want you to come up with a couple of different thoughts. One is in Maricopa County, how we would look at it. Traditional mobile teams are going to look, and when they assess, they're going to assess for danger to self. They're going to assess for danger to others. And also gravely disabled or psychotic, kind of behavior. Those are the big 3 things that I'm looking at. Am I a danger to myself, danger to others, or am I psychotic on some basic level? What we do tend to find in street level work, and those of you that work in the field, there's a lot of folks that are out there. They're not danger to others. They're not DTO, but they're certainly scary to others. They're STO. So in Maricopa County, we frequently use the term STO to mean that person is disheveled, they're attending to internal stimuli, they're loud, they don't quite have boundaries. We know based on our work and our experience and a lot of those things go into, they're not dangerous. But man, they look scary. The community is scared of them. What we really want to be able to do is a good job of being able to identify the difference between danger to others and scary to others. And we should be working with those folks that are scary to others, but not dangerous to others. And we should have police backup or support when we're actually working with somebody in the field that's dangerous to others. What we do see is a mature team in mature, systems that do this a lot. They have a fairly good way of differentiating between danger to self or danger to others and scary to others. And in some communities, the default is let's always go with a police response. Let's always go ahead and have police out there because of diagnosis, because of time of day, because somebody might be impaired. So the default generally is to ask law enforcement to support. I really want you to start thinking a little bit about, are we overutilizing law enforcement? And what are the risks of bringing somebody into the intervention that's got a gun on their hip? Is it the right thing to do for the person? Is it the right thing to do for community to pull that officer off patrol? Or are we doing it for other factors that we can kind of start to avoid? Now, with that said, there are some certain natural intersections where law enforcement should be involved. One is, like I said, that true danger to others, that public safety, public peril. Mobile teams don't carry weapons. Their weapon is their voice, their mannerisms, their ability to engage, and maybe a laptop or a pen and pencil if they're working with a clipboard. So really what the research tends to talk about is they should be involved when there is a potentially dangerous situation. And once again, think about your teams. Do they overestimate danger? Do they underestimate danger, which is just as much? Or since they're out there in the fields interacting, they certainly should be a referral for delivering warm handoffs to mobile teams. If they go out there and determine a crime hasn't been committed, or maybe a misdemeanor crime has been committed, but it's as a result of a behavioral health or substance use disorder issue, they should be able to refer over to behavioral health to help people avoid criminal justice. So we interact with police when they're out in the field and they call us, or when we're out in the field and we need to call them. Those are really the 2 things that we're looking for. So let's jump forward. So a couple things that SAMHSA talks about, and this all goes back to what the research tends to show. We do believe, through SAMHSA, NASHBID, Vibrant, people working at the national level, that law enforcement is often overused in communities. That in most communities, overwhelming, I'm going to say 85 to 95%, if not more, it is the de facto community-based crisis response. We've got mobile teams that are out there, but they've got exclusionary criteria. I won't see people who are drunk. I won't see people who are angry. I won't see people who don't call for themselves. I won't see somebody with an intellectual and developmental disability. So really what I say is I've got a lot of criteria that I can go ahead and exclude you from getting services, and very few that actually include you into getting services. Who doesn't have that? Police. Police don't have exclusionary criteria and say, I'm not going to go because somebody's too drunk or too belligerent or too this or too that. They're going to go. So communities do tend to default to kind of a no wrong door approach. When you go 100% of the time, when you don't say no, they're going to utilize you. When I put up roadblocks or barriers, they're going to go to the next level fast, quick, and start diverting away from you absolutely from Jump Street. SAMHSA also says in too many communities, the crisis system has been unofficially handed over to law enforcement, sometimes with devastating outcomes. If we start taking a look at the numbers, between 25 and 50% of the people that are in a police-related shooting shot by, law enforcement, generally are going to have some mental health or substance abuse issues that are going on board. So once again, if we can avoid, if it's not truly a danger to others situation, and we can avoid the presence of somebody who's been trained specifically to neutralize threats or to go ahead and stop threats or to be able to maybe look at situations with the ability to go ahead and use force, it's going to be a little bit different response than we get. So the fine point is trying to be able to determine early, quick, even at the time of the call, what really warrants police response and what warrants trained civilian mobile crisis response, which is what we're leaning into now. In summary, mobile crisis care, and I'll jump through this fairly quickly, helps individuals experience a crisis event to experience relief quickly and resolve the crisis situation when possible. So think about that. I'm trying to help somebody in the field experience relief and resolve their crisis. Law enforcement's not looking to do that. They're looking for a disposition. They want to meet an individual in an environment where they are comfortable. I can tell you, if I see flashing lights behind me when I'm driving, the last thing I am is comfortable at that point while I'm having that interaction. And what we do when we go around the country and we talk to people about law enforcement interaction, we'll have them raise their hands. When you interact with law enforcement, even if you've done nothing wrong, even if they're supposed to be there, are you comfortable? Are you agitated? Or are you anxious? Are you your normal baseline rate of emotional response? And invariably, nobody is. So when we start bringing officers into the scene, we are going to increase anxiety when really what we're looking to do is help them experience relief quickly and work with them in a space that they're comfortable, and their own home may not be comfortable if we've got law enforcement that's there. We want to be able to provide appropriate care and support while avoiding unnecessary law enforcement involvement, emergency department use, and hospitalization. So if I ask you what the goal of your mobile teams are, we can come up with 30 of them. But one that needs to be in at least the top 3 is our goal is to divert away from law enforcement and emergency departments. It's go ahead and be able to provide a behavioral health focused crisis response to those in behavioral health need. We can go ahead and jump forward. So I want to start talking about actual data and actual numbers, because I think things do get lost. When we start talking about mobile teams and we start talking about call center, we always want to look in aggregate. We always want to look at the big picture numbers. Anything can happen in a day. Anything can happen with a particular intervention. Anything can happen over the course of a week that really skews my data. So when we start looking at data, I always want to look at it on a monthly basis to see what we're starting to look at. And when we want to start to compare, we want to start to compare with other big data sets versus small data sets. I do like using Maricopa County because they really leaned into that crisis. So if we take a look at Maricopa County, total population about 4.4 million, they're taking about 18,000 calls a month at their 988, basically their NSPL line. These are crisis calls that get kind of pushed through. Conversely, if we take a look at LA County and it's 10 million, it's got 2.5 times as many people, they're running just a little bit above that. They might be running 230,000 calls a year, where Maricopa County is probably running about 200 to 210,000 calls a year. So there might be a 15 to 20,000 call difference between LA County and Maricopa County. But once again, LA County is going to have twice as much. That's because we have spent a lot of time and effort of saying, if you're in crisis, call 222-9444, and somebody's going to go ahead and pick up that phone every single time it happens. They've got a less than a 0.2% drop rate. So this is the number that we're starting with. So let's go ahead and jump one through. Actually, let's go back for a second. I did a little bit of math. So really what we look at for those 18,440 calls, it's about one call for every 238 people, or it's about 419 calls for every 100,000 people. So if you sit and think about your community and how many people you've got in your community, 419 calls are going to come to your door for every 100,000 people you have every month, if you're getting Maricopa County data numbers. Strong crisis system in the community that's trusted. Current trusted algorithms based on the National Suicide Prevention Lifeline would estimate that we only get 10,277. So as 988 started to get rolling through, we asked Vibrant, who runs the National Suicide Prevention Lifeline, to start to try to predict how many calls should be coming in. And if we attach that up to our Maricopa numbers, Vibrant, the National Suicide Prevention Lifeline, would predict that we'd only get about 10,000 calls, 10,277 calls. So you can see that with the right marketing, with the right types of service, with I'm always picking up the phone, good client customer care, that those numbers actually can start to escalate. So we see a lot more, what, about 80% more than algorithms would predict that we would see. And once again, we're certainly seeing more per capita than I think any other county out there. But we start with 18,000 calls coming into our call center. And what does that translate then for mobile teams? Actually, let's talk a little bit about where those referrals come in. Let's jump another page here. So if we take a look at Phoenix really has two PSAPs. PSAPs are the 911 dispatchers, coming through police typically. Whereas a lot of your counties, I think LA County has 80. They've got a lot of PSAPs that are going on. We've got two. So as such, we're able to keep data a little bit better or a little bit easier to learn how many of those calls are coming in. So these are numbers from January of 2022. I would have February numbers, but they asked me to turn in my slides a month early for review. So I've only had to turn these in February. So I've only got the January numbers. But you can see that 845 of the 18,444 calls we took, or about 5.4% of our total calls coming in, actually came from the PSAP. Came from the 911 dispatch. Basically, without that, that is 848 times, 845 times. They would have sent a police officer out there to go ahead and do a welfare check, to go ahead and respond, to go ahead and see what's going on. So 5.4% of the total calls. I don't know if that number is good or not. Seems good. Seems very high compared to what we're seeing in other parts of the country. But this is currently where we are. So let's jump one more. So out of those 18,444 calls, mobile teams were dispatched, civilian mobile teams were dispatched 2,063 times. So really what that kind of comes is about 11.18% of all crisis calls coming into the call center. This is fairly consistent in the two crisis systems across the country that really operate with fidelity to SAMHSA guidelines. What I will say about these numbers is that they are really high in comparison. Civilian teams saw about 12,687 people total in fiscal year 2021 in LA County. Once again, 10 million people. We're seeing about 2,000 a month. They saw about 12,000 people with their civilian mobile teams for the entire year. And once again, they're 2.5 times larger population-wise than we are. We saw 23,807 in the last 12 months. So while Maricopa County has really high numbers, we actually do anticipate that we're still only seeing about 70% of the people that need to be seen. We do crisis calculators based on what we anticipate the actual need in a community would be. We utilize the National Association for State Mental Health Program Director calculator that we actually worked and had vetted with them, that is on the crisisnow.com site. And really based on that, what we would anticipate is that about 768 people per 100,000 population would need or benefit from mobile team services. And once again, we see about 70% of that. So that means there are people in the community that are not getting that care at that level. About 30% are not getting what they need. And instead, they are probably doing one of three things. They are either getting the help they need in the emergency departments, getting the help they need with police, or not getting the help. Those are really the three options that people have if they're not using mobile teams, and that's an intervention service they need. So really, while we saw 23,807, we anticipate we could have seen as many as 33,792. I know it seems daunting, but if you build trust and you build it well, people will begin to trust it. They'll begin to call, they'll begin to request it, start to find and identify opportunities for my teams to go out and start to do this work. Now, one thing to think about with utilization is when I get my numbers up, my operations become easier. I start having more consistency with folks that are being seen, which means I can add in teams, which means I can get more double coverage, which means I can get more payment, which means I can really operate better. The toughest thing you run into is if I should be seeing 10,000 people in my county per month or per year, and I'm seeing 2,000. Well, seeing 2,000 people becomes fairly difficult to run 24/7 operations when you're seeing 6 people a day. It becomes financially more difficult. But if I can see 12 or 15 a day, I can now start to plan and get some of that economy of scale to really support me. Let's go ahead and jump up one or move down one. So this is really what we're talking about here is going to be the number of times police call us to take over something on scene. So 438 times in January of 2022. Law enforcement went ahead and called the crisis line, 222-9444, and said, hey, look, I'm on the corner of Elm Street and 5th. I want a mobile team to come out here and relieve me. So 438 out of the 2,063 times we did interventions, it's about 21%. So 21% of the cases that we're rolling to have been initiated by police who have said, I don't need to take this guy to jail. I don't need to take her to the emergency department. I don't want to leave this person in community. So instead, what they're doing is they're saying, look, I think there should be some behavioral health support here. I know I'm not the one to go ahead and do it in my role of law enforcement. And they're going to call and have a mobile team come out. So how many times in January of 2022 did the call center or mobile teams call to request police to go to a scene? It was 102. They called us 438 times and said, solve my problem. We called them 102 times and said, please help solve our problem. And that number actually was a little bit high. How we normally tend to look at it, and it's been this way for years, it's about 3% of the time that we roll mobile teams is going to be some form of police intervention. So for that 2,000 times, I would have anticipated 60 to 65, maybe 70 times that we would call police and ask for support on scene or some kind of rescue or something's going a little bit wacky that we do feel we've moved from scary to others to danger to others. So that number is a little bit high, but it's the actual data. If that goes on a few more months, we need to start doing some root cause analysis. So you can kind of start to see that no matter what we do, and if we can jump one. So no matter what you do, there is going to be a component where I need law enforcement out there because people we do work with are going to be at an increased, potential for danger, and that's either calling law enforcement or perhaps fire response or EMS for the folks that we're serving. But I think collaboration is important for a variety of reasons. Remember, law enforcement is always, no matter what you do, going to be seeing people in the streets. And I do know that there is a huge push to support anybody in a behavioral health crisis not having any police involvement whatsoever. I understand why that would be a desire and a feeling, but from a practical viewpoint, there are going to be folks that we're seeing that are at increased risk of hurting themselves, that a mobile team is not going to be able to stabilize or ensure safety out in the field. And we're going to need to bring in something that can go ahead and support or ensure safety. So law enforcement is always going to be the first to encounter individuals with mental health issues. They may be getting calls that are coming in that says, I've got somebody out here who is yelling and screaming, trespassing, drunk and disorderly, has committed a shoplifting offense. And 911 says, okay, we hear that a crime has been committed. When a crime has been committed, we dispatch law enforcement. Law enforcement is going to get out there and say, yeah, you know what, I understand why I was called, but I think a mobile team is better. I think a facility is going to be better. So no matter what we do, law enforcement is going to be interacting with people on the street. It's what they do. And there's going to be a decent percentage of those folks that they interact with that are going to be more appropriate for the behavioral health system. The concept is if we have collaboration with law enforcement, they're going to utilize us. Like I said, 438 times law enforcement in Maricopa County last month called and said, hey, look, I'm going to hang out here for 30 minutes. If you can get a mobile team out here, I'm going to, basically just walk away from this, knowing that the person's taken care of. 23,000 or 22,500 times actually last year, officers dropped somebody off at a facility. So I'm not taking this person to jail. I'm not taking this person to the emergency department. I'm not leaving them in the street. I'm going to actually drive them to a facility and drop them off. So about 23,000 times last year, officers chose a behavioral health option versus a criminal justice or emergency medical service option for folks in crisis that they came into. So what we do see, and according to the SAMHSA guidelines, I got to do a little bit deeper dive and take a look. Having good collaboration does help achieve some of your behavioral health system goals. Whereas if you're working in silos, you don't. It does reduce suicides. You do get improved client outcomes. It's a little bit more efficient. You can go ahead and ensure that research are being utilized in the way that they need to be utilized. But what you're doing by that is you're ensuring that anybody that gets a criminal justice first interaction, kind of that sequential intercept mapping, then has an opportunity to get into recovery as opposed to getting into the criminal justice system. And remember that early intercepts are key to healthy communities. If we can go ahead and find people that are in crisis, and instead of putting them in jail or emergency departments, we can actually increase their likelihood of long-term recovery and success, which reduces suicide, obviously reduces jail time if there's a diversion option for that, and does decrease crime in the long run if we can help people support their behavioral health well-being as opposed to putting more stress in their system. So let's go ahead and jump one more. So these are the tips that I think we probably need to talk a little bit about. So remember, my experience is working in Maricopa County, running 24 teams a day. I'm going to say a lot of interaction with law enforcement, 400 a month. They're going to call us to go ahead and come on out. Another 102 times, we're going to call them to go ahead and come on out and support. So on a very basic level, 500, 600 times a month, there's going to be some form of interaction in the street between our behavioral health professionals and our peers and law enforcement. So it's 15, 20 times a day. So it's not insignificant. And what we tend to see is this. I want law enforcement to go ahead and call. I want them to trust that we're going to be able to go ahead and support them. And I need to make it easier. If it is more difficult for law enforcement to engage the behavioral health agencies or the behavioral health system than it is to drop somebody off at an emergency department or drop them off at jail, they're going to drop them off at jail. They're going to drop them off at the emergency department, not because that's what they want to do, but they start to have calls start to stack up. And when they're 2 or 3 calls deep, they're looking for a disposition. They've got to get to the next call because that might be a true public safety issue. And they're not sure this behavioral health issue is a public safety issue. So if we go back and we take a look at the average time on scene in Maricopa County for a law enforcement professional dealing with an exclusive behavioral health issue, it's about 45 minutes. Nationally, it's about 3 hours. So if you take a look at how they respond to a criminal call, somebody broke in, I need to take a report, they're out the door, they're back on the street in 15 minutes. They start hitting behavioral health issues, they're going to be waiting 3 hours. And that's going to be, I get there, takes me a while to find the person, takes me a while to talk to the person. I decide I want to take them to a facility. I take them to the emergency department. I've got 3 hours of wall time that I'm waiting there for them to go ahead and accept. I've got to create an off-ramp for them that's quicker and easier to use. And if I do so, it's going to get utilized. If I don't, it doesn't get utilized. And I can't blame law enforcement for not utilizing our system if we make it purposely difficult with exclusionary criteria and so forth. So handoffs are going to be absolutely important. In Maricopa County, anytime law enforcement calls, we do a couple of things. One, they never have to explain or justify why they want a mobile team to come out. 100% of the time, a mobile team is going to come out. They're going to ask a few questions. Few questions are, where are you? What can you tell us about the situation? Can you give us a description of the person? Are you going to be there or are you going to leave scene? And that's really about it. They've already determined that this is not a danger to other situation. What we then do from the call center perspective, and call center and mobile teams run by two different agencies, but the call center is doing the dispatching for the mobile teams. What they're going to then do is tell the officer, you've got a 25-minute response time. We anticipate someone there in 25 minutes. We anticipate someone there in 20 minutes. We anticipate somebody there in 30 minutes. Law enforcement gets kicked up to the top. If I've got two calls coming in, one's law enforcement and one's general, law enforcement goes to the top. If I am en route to another call, law enforcement calls, and I'm the only team available, I'm going to divert to the law enforcement call. Average response time in Maricopa County, 9,600 square miles, 4.4 million people. We've got traffic. We've got a host of issues. Average response time is about 47 minutes for a general call and about 31 minutes for a law enforcement call coming in. So we need to let them know that they can count on in 25 minutes, 31 minutes, 22 minutes, we're going to be there. That way they can choose, do I want to do another diversion? Do I want to do a different option? Do I want to drop this person off at a facility? When we arrive on scene, I've got to get those officers back on patrol quickly. I can't say stick here in the background and stage for the 30 minutes. I'm going to start talking and then I'll come over and tell you that I feel safe. They've already assessed the scene, which means you've got to come onto that into that scene with confidence. We can do this. We got this. This is a behavioral health issue. We're the behavioral health professionals. You're public safety. We're behavioral health, substance use disorder. We are the ones to take that. Once again, get the officers off scene as soon as possible and have 100% acceptance. So if I look at it from a trauma-informed care perspective, and I take a look at a first-year rookie officer, street cop, and I take a look at a second-year street cop, what I'm going to tell you is I'm going to start seeing signs and symptoms of PTSD. I'm going to start seeing trauma responses out there. And we know from a trauma-informed care perspective, repeated exposure to trauma, whether secondary, vicarious, or personal, is going to lead me to start viewing the world a little bit more in black and white viewpoints. And as I start to come to black and white viewpoints, I look at the people in my community helping me or hurting me in black and white areas. And what that means is if I tell you I'm not coming Tuesday at 2 in the afternoon, Thursday at 2, I'm not calling you because you told me you wouldn't come Tuesday at 2. You never come. I've got to be 100% trustworthy, consistent when I'm working with law enforcement. If not, they're going to roll back to the other two places in their community that do 100% acceptance, which is emergency department and jail. I don't want to have to do utilization management. I don't want to go ahead and try to call and try to talk my way into getting the support that I need. You either help me or you hurt me. You're either a victim or you're a perpetrator. You're good or you're bad. It has to be at that particular level or the relationship's never going to be there. We need to build trust between police and behavioral health. So what we have tended to find is the better that they can trust, predict, and have consistency, and the less we rely on them for issues around safety or just security or babysitting, the better off it's going to be. So they know that we're only calling them 102 times out of those really 18,000 calls that have come in. So we're not overutilizing. We're not dumping on them. We're not leaning on them as doing things that we don't want to do. We will frequently let them know, hey, you called us for help 435 times last month. We called you 102. And we showed up 435 times and you showed up 102 times. There's some of that relationship tends to go. So we want to be able to assure that we only call police when we need to, and that there's a legitimate factor for that reason, something that they can do that's within their training, within their scope of work. So I've either got a crime that's been committed or I have a real issue of public safety. So relationships do tend to matter. I've seen a lot of communities where their numbers of law enforcement drop-offs are really low. And they say, oh, this is just as good as it gets. And I'll ask about the relationship. And they're like, oh, we meet with their brass every month. We go out for lunch with their brass. Their leadership absolutely knows us. That's good. But a patrol captain isn't getting the call at 2:00 in the morning on a Tuesday asking for what should I do with this person that I've got in the back of my car. So the relationships tend to happen in two levels. If I don't have a relationship with leadership as an executive, as a director, as a supervisor, if I don't have a relationship with the sergeants, lieutenants, captains, patrol captains, chief of the police department or sheriff's office that I'm working with, I'm never going to get it down. But having that is not enough. I need to start having those relationships with the officers as well. So how do we start to do that? We do it through open houses and facilities. We do it through having in facility work. Heck, we have Gatorade in a fridge that's only accessible by law enforcement. There's a lot of things that you can start to do from that mobile team response. It's ensuring that every interaction your team has with an officer is going to be positive, engaging, and something that they're going to be more likely to go ahead and do. What we also recommend is you try to get into their roll call at least once a month. They're probably not going to allow you in every week. They're certainly not going to allow you in every day, but once a month, somebody that's going to be peer-to-peer, mobile team member and a peer going and sitting in a roll call and just talking about some of the cases they've had, some of the things they've done, giving an officer an opportunity to stand up and say, hey, I called you guys last Tuesday. It was great. Called you last Tuesday. It was horrible. And start to work those things out so that the folks that are actually making your referrals, captains do not make referrals, sergeants make referrals, officers make referrals. So they're back into that system. And really, if there is potential to do ride-alongs both ways, I would jump into it. If I would have the officer ride with a mobile team without their gun, without their badge, but doing a ride along to see what we actually do in that 75 to 90-minute intervention. So they can start to say, holy cow, this is so far above and beyond what I try to do in getting a fast disposition. I like this. I like that I can refer to this anytime and they're going to accept that's a positive. Conversely, I think if you do have mobile team members that are doing ride-alongs with law enforcement, they realize the time pressure, the crunch, and what an officer is looking for as they come on to scene, which predominantly is going to be a disposition. I'm looking for what my end game is fairly quickly. And once you start to get in that cadence and we start understanding each other's cultures, that's where the relationships tend to move. So let's jump on more. So I'm going to talk a little bit about cop culture because it is dramatically different. So I've said some things today that I am not nervous if an officer is in the audience today because I know they probably trust it. But in Maricopa County, we have done a lot of work on allowing our crisis providers to understand what we would call cop culture. We do a program, it's a 4-hour program. We do it yearly. And we do it multiple times per year to ensure that our crisis providers, call center mobile teams and facility-based providers have access to what it's like to be a police officer working today out there in the streets. And out of that 4 hours, what we're doing is kind of a modified CIT training in reverse. So CIT, crisis intervention teams, kind of that training program that officers go through, talks to them about what the system approach is, helping work through that system, but it also does some training on really how to think like social workers or clinicians, to understand more mental health and substance use disorder theory, practicality, techniques that they're not really getting in the police academy. But we've done a horrible, horrible job in behavioral health of saying we need to understand their culture. We know they need to understand our culture to get some of the outcomes that we think that we can get, but we need to understand their culture. So what we do in Maricopa County is we do Cop Culture 101. It's a 4-hour program. We bring in our folks. And when I went through it 9 years ago, basically the CIT liaison, Detective Nick Margiotta with the Phoenix Police Department, now retired, basically held up, it was a DSM-3R, that's how long ago it was, and started reading what the signs and symptoms of PTSD was. That's where I learned the difference between a first-year cop and a second-year cop, that black and white thinking, that good or bad, and how that mentality tends to go, and just how important getting a quick disposition, even if it's not ideal, is when I've got calls starting to stack up. So ultimately, as a mobile team member, when I go in and I understand what that police officer is looking to do and needs to do for him or her to have a successful intervention, and I can support that, I've now built a relationship. If I make their life tougher, more difficult, more complex, less comfortable, I'm not going to get that call back. So what do they define as priority? Dispositions, safety, dispositions. And if I can do that and feel good about getting the right one, that is great. But I got to get to that next call. Could be somebody in danger. What is their training? They've got a very paramilitary kind of organization. I've got to be able to work within that. What are the pressure points? They've got those calls backing up. What's their command structure? And what would trauma-informed care tell us? So if you guys ever want to think a little bit about a Cop Culture 101 training, reach out to the CARE TA Center. We might be able to support in getting something modified for that. Unwritten rules. These are things we do. Maricopa County, it's not written. I can't find it anywhere, but this is an absolute that we know. Who's calling who has ownership. So there is nothing that is worse than an officer calling a mobile team. And then when the mobile team gets there, the officer tells them what they need to do. You need to take this guy to the hospital. You need to take this guy to the detox. You need to make him do A, B, and C. Hate that. It'll happen. Hate it. Conversely, the worst thing we can do is call an officer out to scene because we think there's an issue of public peril and start telling him what he needs to do. You know, you need to arrest this guy. You need to get this guy off. You need to do this. You need to do that. So the unwritten rule in Maricopa County is if you call me as a behavioral health professional and you're an officer, second I arrive on scene, you've already determined this is a behavioral health case. I'm the behavioral health professional. Me and my peer, we understand this much better than you do. It's our scene. I'm going to get you off in about 3 minutes back to doing patrol. Conversely, if I and my peer call you as a law enforcement officer and you arrive on scene, I'm going to give you about 3 minutes of information so that you can make some informed decisions. But I'm already saying there's a reason for you being here, and it's public safety. And you're going to be much better at public safety than I am. I can handle behavioral health 9 ways from Sunday. True public safety does have to come to a public safety professional. And once again, the unwritten rules we always talk about is if I do it 1% of the time, I do it 100% of the time. What you do once is what you always do. It's kind of the focus that we've got about I have to be 100% consistent. I hear this all the time. You guys never, ever, police officers sometimes will call and say, you never get me off scene quickly. And I go back to each case that officer was involved with because we're asking for badge numbers when we're doing that. And I can say, okay, great. We released you here for 3 minutes, 2 minutes, 20 seconds, 1 minute, 48 seconds. God, this one was 10 minutes. This one was a minute 30. This one was 2 minutes and 30. But that officer is remembering that 10 minute. We could do it 100%. We could do it 99% of the time. Great. That 10-minute one is going to be the one that comes back and gets me. I've got to be very consistent. So the question that really comes back to me is this. So think about it from this viewpoint. If I'm a mobile team member and I give an officer a hard time, and let's say it's the second year on the beat, let's say he's got 10 years that he's going to be doing street level work before he moves to a desk or something else. How many people can he call, or how many times can he call me a week to go ahead and request backup? Conservatively, it's 1, maybe 2, maybe 5, but let's say conservatively 1. So if they stop calling me because of a bad interaction that they have with my mobile team members, that's about 48 people a year, because they're going to be on vacation a little bit, that they could have referred to the behavioral health system that they don't. Over the course of a 10-year street career, that's about 480, maybe 500, maybe 450 people that they could have supported by getting into the behavioral health system that they don't, because you had a bad Tuesday, because you decided that you did not want to work with them, or that you knew best, or that you weren't using your clinical skills in a collaborative effort to create therapeutic rapport and engagement with the law enforcement officer. So it's absolutely imperative, because they will not call you and ask to come back. And more often than not, they're not even going to call to complain. They just ghost, they're gone. So if I sit there and I think about, do I want to always be right, or do I want to be able to support the most people the best I possibly can? I need to work with law enforcement, understand we have a different culture. The better I understand that, and the more I am willing to support to help my community, the better off that we're going to be. These are all the things that you need. And if you start missing any of them, your numbers are going to start to decrease, or going to start to rise. And once again, from a community aggregate-based level, 1% or 2% or 4% or 10% drops is impactful for your entire community. So I think we do have about 13 minutes left for Q&A. And remember, this is our last session. So if you had something that you were waiting to ask, now is probably the time. It doesn't have to just be on law enforcement. It can be on anything else that we want to take in our last 10 minutes here.
I was making notes as you were going through your presentation to have follow-up questions, and as you proceeded, you were answering the questions. And I think one of the things that I appreciated in this was building rapport between the team members, especially the peers, and the law enforcement. And so you talked about the community, monthly collaborative meetings and joining roll call. And I thought those were both really innovative ideas, and the reverse ride-alongs, those ride-alongs as well. So I thought that would be something interesting to dig into a little bit more strategically. How do we set those up? How do we get onto roll call? Who hosts the community meetings? I'm sorry, the collaborative meetings. Because even placement matters. Is it in the community? Is it at the police department? Those type of things. So any nuanced information there might be also helpful.
So we do, I mean, we do a lot of things, but as far as the community collaborations go, generally you're going to do it offsite because you're going to invite multiple police departments unless there's a reason not to. So, my experience with with police departments is there are times when there may be some turf issues between different departments or a sheriff's office and a city office that you're not sure about, and they don't really want to come to meetings together. But more often than not, they don't mind. So what we end up historically doing in Maricopa County is we have these we've got 25 departments in Maricopa County. It might be 27 now, departments in Maricopa County, and we're going to invite them all to come. We like to host that. We like to buy the snacks, the coffee, the drinks, set the agenda. So if they want to come, they come. If they don't, they don't have to, because I'm not looking to make their lives more difficult. I'm looking to create them opportunity. And historically, we set them up as a problem-solving option. We say, look, we got 600 interactions a month out in the street. They're not all going perfect. We know they're not all going to go perfect, but this is the opportunity for us to discuss them. And invariably, that hour and a half meeting is 30 minutes of practical discussions and about an hour of just socialization and networking, because there's not a lot to go through. The other thing I didn't put in the tips, and actually is fairly important, is the brass, basically leadership, patrol captains and so forth, have our phone numbers of our supervisors in Maricopa County. So if there's a problem at 2 a.m., that officer is going to call the sergeant. Sergeant might get a hold of a lieutenant. Lieutenant might call the captain. Captain's going to go ahead and call my administrator and say, what the hell are you doing out there? You've got somebody on scene 15 minutes. You're telling them what to do. I don't like that. Mm-hmm. We're going to go, yes, you're right. It should not be like that. Let me step into that. Let me manage my staff. Because once again, there's a chain of command. So on a very basic level, they know they need to move over to somebody at a similar level to them to then move down to their rank and file. So these are the types of things you come into. So when we do the monthly collaborative, a lot of the in the now should have been dealt with in the now. There's nothing worse than you get blindsided at 3 weeks ago, Officer Smith had this happen. You're like, I didn't know anything about that. Right. It's always best if I can deal with it then. And then those collaborative meetings are really just the relationship aspect.
That makes sense.
Like I said, roll call is going to get you with the people that actually refer. Ride-alongs get you with the referral. Facility-based work is a little bit easier because when people are dropping things off, you can pull them aside, take a few minutes before they return, back. You can get them some drinks, you can get them, coffee, you can give them on tours. Mobile teams, usually when they see you, they're looking to leave as soon as they can. It's a little bit difficult, but I do think roll call, I do think the ride-alongs, all of those things tend to help. Yeah, we've been talking for 8 weeks. Most questions may have been asked 4 weeks ago, 5 weeks ago.
There's so much good stuff. I think my last question was, are there any tips that you have in the hiring process for peers to introduce the concept of what this relationship will look like with law enforcement?
No, I probably, if I sit there and I think about it, during part of the hiring process, you're asking how people manage stress, what they do for self-care, and then you're describing what you do. And when you're describing what you do, obviously 23% of the time we're out and seen is because an officer has called us and we're taking over, and I can say that as I've interviewed, dozens of peers, there's going to be some times when you say, yeah, we're going to be out there, we're going to meeting with the officer to go ahead and take over, and you can see a visceral reaction. I do tune into that, but I don't have a specific way that I'm trying to determine how that one is going to go ahead and work. But quite frankly, the majority of our peers have had interaction with law enforcement in a professional capacity. That's not something we shy away from, but they're going to have to understand that the role is a little bit different at this point, that we are really looking to make their lives easier, because without that, they're going to disengage from us, and that hurts my community.
Yeah.
So we're going to use our therapeutic skills. We're going to use our boundaries to go ahead and ensure that we move into it. But if a peer really does not want to work with law enforcement, there are places to work within the crisis system that they don't. Mobile team is just not that intersect.
Yeah. Yeah. I love that. And I love the perspective that you gave around the ripple effect. Is it what does this mean? My interaction right now, the 48 others that this will impact over the next year. So I loved that was a perspective that you gave in both directions. And just naming that everybody gets nervous when the lights go on behind. And so, naming that and then moving forward with it. I want to invite you to also check us out on our website. We have Facebook, Instagram, and Twitter, and we have our newsletter, which you can sign up for on our website. If you have any questions, you can email caremhsainfo@cars-rp.org. And for the chat, I hope that got answered, but that is also where you can put the information in. Thank you, Ruth, for responding to the question. So you do have the option of getting the recordings and setting up a screening for your team members, because that is extremely valuable information that Jamie has been able to bring to us through the CARE TA Center. We thank you all for your time.